So before we get started, we'd love to share our rap song introduction video, and we hope you enjoy.
Yeah, okay, organic base, this is what you need. Take you to the future, live a life that can be disease free. All these toxins are taxing on our bodies, no doubt. All these GMOs and these processed foods we can live without. Yeah, wanna see you live a long time. Contaminants in our water and our food supply. From the meat to the dairy and the fish, what a shame. Not realizing that my insides were inflamed. Hold up, I know it's hard to digest, that's right. I found an organic plant-based website. I even got the app, yo, this is where it's at. Promoting a healthy life, it's time to put it on the map. Assuaged, trust you don't wanna miss. It's time for you to be your best, be your healthiest. Assuaged, trust you don't wanna miss. It's time for you to be your best, be your healthiest. Hey, Assuaged, let's go.
Welcome. Thank you so much for joining our student team today. We will be covering the topic of breast cancer awareness. We'd like to thank our student speakers for joining us today: Bishara Sheikh, Crystal Rylowicz, Huda Dawood, Jayashree Salian. Our slide contributors: Soleil Zamora, Huda Dawood, Shah Woods, Aysha Rahman, and Jayashree Salian. We'd like to thank our Restream partner for supporting our student team. Restream's powerful multi-platform streaming capabilities have broadened our reach, connecting us with diverse communities across various social media platforms. Our message of public health and wellness now reaches those who need it the most. Thank you, Restream. Today on the agenda, we have the introduction, what is breast cancer, diagnosis of breast cancer. We have the risk factors, prevalence of breast cancer, screening methods, life factors, depression and mental health, breast cancer and pregnancy, and the final conclusions will be treatment and prevention and breast cancer survivorship. What is breast cancer? Breast cancer is a type of cancer that forms in breast cells. While it occurs more commonly in women, both men and women can be diagnosed with breast cancer. Symptoms: a change in breast size, shape, or appearance, a change in the breast skin, a newly inverted nipple, a lump in the breast that feels different from the surrounding tissue, redness or pitting of the breast skin, peeling, crusting, flaking, or scaling of the breast skin or the areola.
Types of breast cancer. Angiosarcoma forms in the lining of lymph and blood vessels. Invasive lobular carcinoma begins in lobules on breast and spreads out. DCIS, which is ductal carcinoma in situ, forms in milk duct. LCIS, that is lobular carcinoma in situ, forms in the milk glands or lobule. Inflammatory breast cancer, when there is a blockage in the lymphatic vessels of the breast skin. Paget's disease of the breast starts around the nipple and extends to the areola. Male breast cancer forms in the breast tissue of men, recurrent breast cancer that comes back after initial treatment. Now let's know about the breast cancer diagnosis. What are the different types of diagnose? What are the different ways to diagnose breast cancer? Breast examination, which involves checking of for lumps or abnormalities in breasts and lymph nodes. Mammogram, which is breast X-ray. Breast ultrasound, that is sound waves produce images that show lumps. Biopsy, remove a sample of breast cells for testing, the only definitive way to diagnose. Breast magnetic resonance imaging, that is MRI. Magnets and radio waves produce an image of the breast interior. Risk factors. So there are several risk factors that involves the possibility of breast cancer. Let's start with gender. Incidence is much higher in females than males. Giving birth at an older age, after the age of 35. Age incidence increases particularly after the age of 40. Not breastfeeding after giving birth puts a woman at high risk. Genetic factors, 5 to 10% of cases are hereditary. Using hormone replacement therapy to treat menopause symptoms. Early menstruation before 12 years of age. Using hormonal birth control methods. Risk decreases after stopping use of these. Family history of any type of cancer. Eating lots of fatty and processed foods, which could potentially elevate the levels of saturated fats and thereby increasing the chances of cancer growth. Late menopause after 55 years of age, lack of exercise that could increase growth factors associated with cancer, exposure to radiation therapy in chest area, obesity, particularly after menopause.
Prevalence. Global statistics are 2.3 million women diagnosed in 2020. 685,000 deaths occurred in 2020. Approximately 0.5% to 1% of breast cancers occur in men. Between 1980 and 2020, death rates decreased by 40% in high-income countries. The World Health Organization's Global Breast Cancer Initiative, GBCI, is to reduce global breast cancer mortality by 2.5% per year, averting approximately 2.5 million breast cancer deaths globally between 2020 and 2040. Breast cancer in the United States. Most common cancer in women except for skin cancer. Second leading cause of cancer death in women. Accounts for 30% of all new cancer cases in women per year. The American Cancer Society estimates for 2023 in the U.S. 297,790 new cases diagnosed in women and 43,700 breast cancer related deaths. Screening methods for early detection. Women with breast cancer can be asymptomatic prior to detection, meaning they show no symptoms before finding breast cancer. Breast cancer that's found early when it's small and has not spread is easier to treat successfully. Getting regular screening tests is the most reliable way to find breast cancer early. What are screening tests? Screening refers to tests and physical exams used to find a disease in asymptomatic people. The goal of breast cancer screening tests is to find the cancer early enough before it causes symptoms, for example, a lump in the breast. What is early detection? Finding and diagnosing a disease earlier than if Um, you waited for symptoms to start, I believe. Screening methods for early detection. Mammogram. Most common low dose x rays, 87% accurate. Possibility of false positives. Detects microcalcifications, which are tiny deposits of calcium that may be indicative of breast cancer. Clinical breast exam, CBE. Physical exam is done usually during an annual medical checkup for women over the age of 40. They can detect lumps and they are 70% accurate. Breast magnetic resonance imaging, which is an MRI, uses magnets and radio waves to take pictures of the breast, can be used for women who are at high risk, more sensitive modality for detection up to, I'm sorry, I can't see the rest of that. Breast cancer and depression. Depression is very uncommon in patients suffering from any form of cancer. Feelings of depression can be temporary or short periods. However, there are more severe forms like major or clinical depression. Major or clinical depression can make it difficult for cancer patients to follow treatment plans or even function. Depression happens in around 1 in 4 cancer patients, and someone who has been diagnosed with depression in the past are more likely to have depression post cancer diagnosis. Signs to look for: weight loss, a feeling of hopelessness for most days or every day, extreme feeling of exhaustion or tiredness, sleep pattern changes, thoughts of death or suicide, hard time focusing, remembering, or decision making, and a loss of interest in doing things. Management includes counseling, medication, and a combination of both.
What the patient can do: attending the support groups and counseling, talking about feelings with your friends and family, use mindfulness techniques or types of spiritual support, work with a professional counselor to learn how to deal with your big life change, ask what treatments are available if you need help, what friends and family can do, listen without judgment, avoid the physical phrases of think positively, it will be okay, etc. Ask them what you can do to support them. Do not force the patient to talk about their feelings if they are not ready to or do not want to engage in activities the person likes. Important to remember that caregivers can become depressed as well. Take care of yourself too. Breast cancer and pregnancy. Finding breast during pregnancy. Breast cancer does not commonly occur during pregnancy. Around 1 in every 3,000 pregnant women. It occurs in around 1 in every 3,000 pregnant women. Due to breasts becoming larger and more tender during pregnancy, it makes it harder to notice lumps caused by cancer. Breast cancer tissues can become denser due to pregnancy and breastfeeding, making it difficult to see early cancer on a mammogram. Most cases of breast cancer are found at a later stage due to the challenges of diagnosing and pregnancy. Breast breast biopsy during pregnancy. It is typical that a biopsy is done if there is a breast lump or abnormal imagery test alert concern. The most common form of biopsy used, even if you are pregnant, is core needle biopsy. It uses a hollow needle in order to remove breast tissue, uses a local anesthesia, and little risk to the fetus. If the core needle biopsy does not give definitive results, a surgical biopsy is done. A larger portion of breast tissue is removed from an incision. Use general It uses general anesthesia, which causes a small risk to the fetus. Breast cancer and pregnancy. Pregnant women with breast cancer are able to be safely treated. However, the type of treatment and time of treatment can be affected by the pregnancy. General surgery while pregnant is safe. Chemotherapy during the second and third trimesters appear to be safe for the baby. However, it is not safe during the first trimester. Other breast cancer treatments like hormone therapy, target therapy, and radiated therapy are more likely to harm the fetus and are not typically received during pregnancy. Treatment recommendations will vary based on size of the tumor, location of the tumor, how far or if the cancer has spread, overall health of the patient, and personal preference.
Breast cancer happens most commonly in women. However, men can also develop breast cancer because they too have breast tissue. Breast cancer commonly starts in the ducts that bring milk to the nipple, and some can start in the glands that produce breast milk. Even though they are not normally functional ducts and glands, men can also have these. Types of breast cancer in men. Majority of breast cancers are carcinomas, with adenocarcinoma, a type of carcinoma, being the most common. Less common forms that start in cells of the muscle, connective tissues, or fat are sarcomas, phyllodes, Paget's disease, and angiosarcomas. Signs and symptoms are skin dimpling or puckering, nipple retraction, lump or swelling, typically but not always painless, discharge from the nipple, and redness or scaling of nipple or breast skin. Breast cancer treatment. Local treatments like surgery and radiation that target the tumor without affecting the rest of the body. Surgery is often the primary treatment for breast cancer. The tumor is typically removed based on the type, stage, and advancement of the cancer. Systematic treatments. Systematic therapies for breast cancer include chemotherapy, hormone therapy, targeted drug therapy, and immunotherapy. Who treats breast cancer? A breast surgeon or surgical oncologist, a radiation oncologist, a medical oncologist, or a plastic surgeon. CAM as an alternative breast cancer treatment. Many breast cancer patients in the U.S. use CAM therapy, also known as complementary and alternative medicine, ranging from 48% to 70%. Examples of complementary and alternative medicine include acupuncture, Tai Chi, yoga, and other mind-body therapies, vitamins, herbs, and other nutritional therapies, and American Indian and Alaska Native traditional healing practices. Why is prevention so important? To reduce the risk and chances of developing breast cancer, and to reduce deaths caused by breast cancers. According to the Mayo Clinic, breast cancer prevention starts with healthy habits such as limiting alcohol, staying physically active, and maintaining a healthy weight. Research shows that lifestyle changes can decrease the risk of breast cancer, even in women at high risk. For example, limiting alcohol intake and maintaining a healthy weight can help reduce the risk of developing breast cancer. Breastfeeding might also play a role in breast cancer prevention. The longer you breastfeed, the greater the protective effect. Breast cancer survivorship. The American Cancer Society uses the term cancer survivor to refer to anyone who has ever been diagnosed with cancer, no matter where they are in the course of their disease. Breast cancer survivorship begins the moment of diagnosis. A healthy lifestyle. Some healthy behaviors may be linked to a lower risk of breast cancer recurrence and improved survival. A healthy lifestyle includes maintaining a healthy weight, eating a healthy diet, limiting alcohol intake, getting regular physical activity or exercise, and not smoking. Finding support programs. Hospitals and cancer centers have specialized programs that provide care for patients after they complete their main cancer treatment. These programs help manage treatment side effects, refer specialists, provide resources for mental health support, and address many other post-treatment needs. Mental and emotional health. After being diagnosed with breast cancer, some people may feel anxious, sad, or stressed. These feelings can subside as time passes, and other times these feelings can linger for months or even years and begin to affect daily life. Anyone diagnosed with breast cancer can benefit from mental health support.
Thank you so much. We are going to move on to the questions now. Time for our student discussion. What kind of impact does stress have on breast cancer? Stressful events, losses, and trauma can weaken the immune system and increase cancer risk. The impact depends on a person's response, not the event. Although no conclusive evidence exists that stress and anxiety directly causes breast cancer, reducing stress levels and increasing daily comfort, joy, and satisfaction are crucial to improving quality of life. Stress management techniques, including relaxation exercises such as meditation, yoga, visualization, and prayer, can help strengthen the immune system and overall resilience to stress. For the question number 2, how often should I do a breast self exam, BSE, or be clinically examined? Performing a breast self examination, BSE, once a month after age 20 is essential. During the examination, look for changes in size, lumps, dimpling, or puckering of the breast, nipple inversion, redness or scaliness of the skin, or nipple discharge. If you find a persistent bulge or any changes, seek medical attention immediately. Although most lumps are not cancerous, it is essential to get them evaluated to rule out the possibility of cancer. Additionally, it is necessary to have a yearly physical that includes clinical breast and pelvic exams starting from the early 20s. Third question. Does smoking or drinking contribute to my risk of breast cancer? Smoking and secondhand smoke increase cancer risk, including breast cancer. Smoking also causes heart and lung diseases linked to higher breast cancer risk in premenopausal women. Secondhand smoke increases risk among postmenopausal women. Drink moderately. A recent report by the AICR and WCRF found that even a tiny glass of wine or beer per day can increase the risk of breast cancer by 5% for premenopausal women and 9% for postmenopausal women. Consuming more than one drink per day increases the risk regardless of the type of alcohol. Alcohol can elevate hormone levels linked to breast cancer. How can I find the right support group? It's important to note that there isn't a support group model that's perfect for everyone. You need to find the one that suits you best. Support groups cater to specific needs of people with breast cancer, such as those recently diagnosed, undergoing chemotherapy, or dealing with fear of recurrence. If you're looking for a support group, a good first step would be talk to a patient navigator or a social worker. You can also reach out to the Komen Breast Care Helpline at 1-877-GO-KOMEN or send an email to helpline@komen.org to get help finding a local, online, or telephone support group that's right for you. I'm going to go ahead and bring us all on the screen here so we can have a discussion. That was a wonderful presentation. Jayashree, what are your thoughts, my dear?
Yeah, it was certainly wonderful to know so much about the breast cancer, and especially about the role of smoking and drinking. I mean, I'm surprised that it was not included in the risk factors when I read that slide. But looking at the lifestyle that we live in today's world, I think that is something every 20 plus women should keep in mind, because I mean, if it is a risk factor, we have to be vigilant about it, because more or less everyone drinks and they like to smoke, I guess.
Absolutely. And with breast cancer, it's so random. I have had several friends and some family come with breast cancer, and it just seems like you just have to go and get those checkups, and you have to be due diligent about your health. I've read that if you have children and you don't breastfeed, and I believe that was on the slides that you guys covered, that's a high risk. So it's just really doing the checkups and the due diligence around that. Crystal, what do you think, my dear?
I don't know anybody personally who's had breast cancer. However, I'm a little bit concerned because I met most of those things on the risk factor, from age to having all different types of cancers run genetically in my family. And so I am doing my best. I have lost 20 pounds over the course of 6 months. Um, and so, that's a huge relief for me. I still have about 60 to go. And I know that because I'm 44, I have to work a little bit more at that. I'm watching what I eat, but I also have other health problems that, make it a little bit harder besides my age to lose weight. So I definitely make sure that I get examined yearly by my doctor. But like Jayashree said, I'm very surprised that smoking and drinking alcohol was not on the risk factors, considering at the end that even 4 to 9% pre and postmenopausal, those are some big numbers if you think about it. Uh, for such unhealthy habits of smoking and drinking. So I'm a little bit alarmed, and I'm going to work a little bit harder to decrease some of those um, risk factors that are going on in my life right now.
Thank you for sharing that. Bishara, what do you think, my dear?
I would say that I have read a couple of documentations about breast cancer, and the one thing that is not highly emphasized is how much alcohol is itself a carcinogenic, and not just breast cancer, but to all cancers. So, when it comes to breast cancer in women, especially based on genetics, and if someone who has had or has family members who have had breast cancer before, it kind of becomes an issue or something to look into and be more careful about, because you are more predisposed to the DNA and anything that can lead to that can lead to breast cancer. Beside that, I would say that it was every that was a great slide. I felt like I had learned a lot about it. So yeah.
Absolutely. The slides that you guys all did are so incredibly informative, and I kind of can feel how Crystal's feeling like, oh my God, maybe I shouldn't drink it, because I do have like a glass or two of wine. I mean, I didn't have any last night, but more so than not, it's really stressful running corporations and being a PhD student. So, I like to have my glass or two of wine. But there's risk factors in everything, and those are definitely considerations to weigh in on. Huda, my dear, what do you think? Huda.
What I found most interesting was the slide on complementary and alternative medicine. I had no idea that such a large percentage of people tried that route, and I think it's great to try CAM therapy in conjunction with, I suppose, more traditional therapies. Um, and looking at the types, it kind of makes sense as to why people would go to these, because a lot of them, like, for example, yoga and mind body therapies, are all about relieving your stress, and stress is something that definitely can come with breast cancer diagnosis. And so I think it's great that people are using other alternative medicine at the rate that they are.
Absolutely. And, with breast cancer, it's just any kind of cancer. I think, the whole purpose of the Assuaged mission is really tapping into organic, clean foods. Even if you can get non GMO, looking at the ingredients, making sure there's not more than 5 ingredients, tapping into, I like to do a lot of juicing. I like to eat a lot of raw foods, cook them up. I'm not really into eating too much processed foods, which I know in any cancer that those are factors to consider. Is your overall health, taking a lot of prescription drugs. I mean, everything accelerates anything that comes about. So it's not just, I know in my mind I was mentioning the wine, but it's not just that. It's everything, every chemical, environmental, biological substance you're putting into your body. Stress, you wouldn't believe that stress would be such a factor in causing or accelerating any disease, but those are all things to kind of consider that can weigh in on that as well. Jayashree, did you want to add anything else, my dear?
Um, no.
No.
I mean, also the age. I mean, for the self examination, as early as 20 years. I mean, that was again very surprising for me because I always thought I mean, self examination is for women after 40. I mean, that is also quite surprising. 20 is too early, and I bet with the lifestyle that we live in, that totally makes sense, and it is just taking precautions.
Absolutely. Thank you so much for sharing that. I had forgotten to expand you earlier, so I wanted to get you on the screen there so everyone can see how beautiful our students are. All of you have done a tremendous job putting together this presentation. Really want to thank you guys for standing up on that, and yeah, clapping for you guys. And yeah, we thank you guys for tuning in and joining us. We do these presentations weekly. We have a few interesting topics coming up, so please join us. And thank you again. We'll see you guys later.